If there's one thing we've learned from the pandemic, it is the importance of health care. It saved lives these past few years. The hard part now is paying for it. Everything's more expensive, right? And some major changes are in the works. They're causing even more problems for people in Kansas and Missouri. Take Medicaid, for example, the government-funded health insurance for low-income people and families, those with disabilities. Before the pandemic, recipients had to prove every year they still qualified for health care. The government waived that rule in the pandemic, and federal law prevented states from dropping people from Medicaid. At the time, states could lose funding if they didn't stop that. And now that the public health emergency is over, though, states are once again going through the rolls, finding recipients who are no longer eligible and kicking them off. And what's interesting here is if the state can't get in touch with someone to verify that they're still eligible, recipients can be taken off of coverage for procedural reasons. That's leading to confusion across the country.
A lot of times folks don't realize they've lost coverage until they go to pick up a prescription, go to the emergency department, which is about the worst time to figure out that you don't have health coverage.
The Kaiser Family Foundation estimates as many as 14 million people will lose coverage in the coming year because of these changes, including people in both our states. Joining me now to get to the heart of the matter is Iva Shepard, Senior Outreach Program Manager with the Missouri Primary Care Association. Iva, thank you so much for coming on and walking us through this. Set the stage for us. How big of a problem is this in Missouri right now?
Well, thank you very much for having me. What we're hearing from Missourians right now, some are aware that this is happening and they're doing everything that they can. The technology that the state, the Family Support Division, has set up has been some challenging for some people. Our navigators have received multiple calls for help. Some are being renewed, but unfortunately we don't have those numbers of how many that are not being renewed.
Because it's just really getting rolling in Missouri this month, right?
Yes, that is correct.
We know you work with a network of health centers across the state. What are you hearing from the boots on the ground and from the patients who are now maybe going to the ER or the pharmacy and realizing, oh wait, I'm being told I don't have coverage?
Well, what we are hearing is that they are very familiar with our federally qualified health centers. And so they're contacting that outreach staff member that's at the FQHC, and they're able to help them to either, if their Medicaid has been canceled, they're able to help them get that annual renewal done online or by paper and sending it in, or if they are not going to be eligible for Medicaid, they're able to review other health care coverage that's available.
I think one of the most surprising things to me is just the procedural drops, the procedural disenrollments, that if they can't get a hold of you, okay, you're off the roll, and then that many people won't know that this is happening. How do you alleviate that? Just education? Education,
absolutely. Doing things like what we're doing today is getting the word out and letting them know that making sure your address is up to date, number one. Check all of your mail. Even though it may look like junk mail, please open it, because the annual renewals are coming in envelopes with windows on it.
Okay.
And they are yellow, and it also has a time-sensitive stamp on it. So please open up all of your mail. And then you can call showmecoverage.org for help. Because we have trained staff and it's free to be able to help you through that.
So is the address the biggest problem right now? Is that
yes,
okay.
Yes, the address is. Because during the public health emergency, annual renewals were not sent out. And if you've moved even one time and you haven't updated your address, it's going to go to your old address. So please get that updated so you don't lose coverage.
What's the biggest misconception that you're trying to battle right now?
That even if your case has been closed, you still may be eligible for Medicaid.
Really? You can contest it?
Yeah, well, by going in there, by contacting one of us, the trained staff, our navigators with our FQHCs here in Missouri, they know where to go. They know where to find the information, and if someone is still eligible and the case has been closed because of the annual renewal, the workers can go in and fill that out and then get that case reopened if they are still eligible. Now, if they're not eligible for Medicaid, there are other health insurance programs that are available. But one thing I do want to share too is that if you're an adult and you get this annual renewal in the mail and you say, oh, I don't think I'm going to be eligible, go ahead and please fill that out and send it in, especially if you have children in the home, because they still may be eligible for another different level of care under MoHealthNet.
That's a good point. Also, thinking about just moving forward this year, if somebody gets a note in July, that's one thing, but other people, depending on when they were approved, right, could be getting this further down the line. So no news is not good news in this
Correct.
situation.
I would encourage everyone to be very proactive with this, just call, check and see when your annual renewal date is. We can look that up in the system for you. And if your annual renewal date is not due until September, or if it's not due until November, you'll have heads up. You'll know in plenty of time that you'll get it during that time frame.
Okay. You know, nearly a quarter of Missouri's population is on Medicaid right now. So with this information and these big changes that are hard to navigate, as you say, what's your biggest concern moving forward?
Our biggest concern is that people could lose coverage and everything that comes along with that. Just like earlier you mentioned in reference to they're not going to know until they come to the doctor. Let's be very proactive, getting the information, the news out that this is happening, and making sure that you don't lose that coverage. And we're also worried about, because people haven't done this for 3 years.
Right. It's not
Yes.
old hat anymore.
Right. And some individuals that have been approved may have never received an annual renewal. If they're brand new to the Mo Health Net, like under the Medicaid expansion program, they've never received an annual renewal before.
All right. Well, we appreciate you coming on. Ivor Shepherd, thank you so much. Remember, help is out there. This affects so many families. For more health insurance resources in Missouri, you can go online to showmecoverage.org. Also, as Ivor said, staffers are standing by to help. You can call this number 417-840-6788. Kansas website also has information on Medicaid renewals. You can go to cancare.ks.gov there to get started.